The United States now has the highest coronavirus infection rate and the highest death rate from COVID-19 in the world. But recent reports have highlighted racial disparities in contraction and deaths related to the outbreak in the U.S. Last week, a number of media sources focused on key demographic data coming out of several U.S. states, indicating that African Americans and Hispanics appear particularly vulnerable to the disease. Why is this the case, and what steps might be taken to ensure adequate protection for vulnerable populations during this and future public health crises? To help put this crisis in context, I'm joined by Skype in Hong Kong with James Chau, host of the China Current and Goodwill Ambassador to the World Health Organization, and by phone in New York, Professor Richard Lachmann from the State University of New York at Albany. Gentlemen, welcome to the show. Let me go to Professor Lachmann first. It's been reported that African Americans face alarming rates of coronavirus infections and that this trend is playing out across the U.S. And public health officials are concerned, and even President Trump noted the disparity in a recent press conference. Why is it that in states like Illinois, Michigan, and Louisiana, the African American population appears overrepresented amongst those infected?
I think there are two reasons for that. One is that we now know that exposure to air pollution makes people more likely either to get coronavirus or have more serious cases. And, for really forever, African Americans have been more likely to live in areas next to factories that emit lots of pollution. There's a good understanding now of what's called environmental racism. And then the other factor is, since African Americans tend to be poorer, they live in smaller homes with more people in it, so they're closer to each other, so they're more likely to be exposed to coronavirus and pass it on to each other. And then on top of that, African Americans are less likely to have health insurance. So if they get sick, they're going to be very reluctant to go get tested, go to the hospital, because they'll be stuck with enormous bills for that and then be bankrupted. So when they finally do make it to the hospital, they're going to be in much more serious condition, and there'll be less time to treat, and they're more likely to die. So all of these factors together make it more likely that African Americans get the disease, and when they get it, it's much more serious for them.
James, from a wider perspective, from the World Health Organization perspective, according to your understanding and observation of public health crises, how much does this particular trend stand out for you, and how alarming is that?
Well, very alarming, I think, because it is very real, Lucine. And first of all, thank you very much for having me always on your important program. I have done a lot of research on this, and I've spoken to a lot of friends who represent the African American community in different parts of the states. A lot of them are racial justice and civil rights advocates themselves. And they point to the susceptibility of the African American community there to underlying health conditions, say, for example, heart, lung, respiratory, diabetes, and more. But at its core, and I think what the professor there indicated, is an institutional, a systemic, a structural racism in the healthcare system and in access to public services over there in the first place. And what this has done over the years, as Black Lives Matter has pointed out as well, is that this has led to high rates of chronic diseases in that community, but also to lower rates to quality healthcare. So when combined, and then you throw on COVID-19 on top of that, which is not just a health emergency, which really is an emergency that takes on significant social and economic dimensions, you're now led to this path where not only those who've been left behind are left behind, but those who are left behind in the first place are even being left further behind than they were before. It's a combination of these factors. It links to poverty, it links to education, to gender. One part is not detached from the other, and we have to look at it as a complete sum.
Yeah. According to a study, and again, I want to go back to Professor Lachmann, according to a recent study published by Brookings Institution in Michigan, for instance, African Americans are 130% more likely to contract the virus. And in Illinois, although they only represented about 16% of the state's population, they make up 30% of COVID-19 cases. Did anybody foresee this was coming up, first of all? And was the disparity in availability to public health resources, for instance, already a problem that were visible to policymakers, to experts, to advisors, or was it all of a sudden exposed by the onslaught of this crisis?
No, I think it's been visible for a very long time. It's no secret that African Americans are much less likely to be insured. There's extensive research that even when African Americans go and see doctors, the doctors, because of conscious or unconscious racism, make less effort for their African American patients. They order fewer tests. They're less likely to follow up rigorously with these patients. So, African Americans have a shorter lifespan in the United States. They have more chronic diseases. They have less insurance, so none of this is a surprise, and nobody, should, be surprised that they're dying at a much higher rate.
It sounds very sad. I mean, it sounds very, very sad. The reason why I asked that question is if this was a problem already noticed for a long time to come, was there something being done about it? And after this, James, after this coronavirus incident, do you see any signs that the situation might be corrected or start to be corrected?
Well, it's very interesting.
Yeah,
well, it's very interesting. I spoke to a few different friends. One of them, Latifah Simon, talked about the world being brought to its knees, and where was the battle cry from communities and from government leaders to do something about this. And let's go to one example over here. I spoke yesterday to Attica Scott, who's one of the few women of color elected to public office. She's a state representative in Kentucky, where the state has about 8.4% of the population is black, but they have a 12+% rate of infection of COVID-19. And she talks really very much about hope. What are we going to do after this? And she really talked about getting together with the other minority groups, the other peoples of color, like you mentioned, the Latinx community, the Asian community, which has suffered a lot from the racism due to the coronavirus being perceived to being from Wuhan and also from China. She talked about the power and the magic if those communities could come together. I wanted to delve deep in what racism meant to her, and here's what she told me. You ask a black man to go out there with a mask in a country with a well-documented history of police violence. They want to keep themselves safe, but in fact you're putting them in danger by asking them to go out with a mask in the first place. And also what the professor said in terms of this bias which exists in the system in the first place. You're talking about black people going to the hospital and then someone saying, you're fine, it's okay, there's nothing wrong with you, take a paracetamol, come back in another week, or so and so forth. So when we talk about racism, it doesn't have to be direct, but it can be implicit in its impact. And I just want to say here at this point, Lucien, because you brought up a very, very important first half of this program, none of us is immune to making serious mistakes. Right. And when we talk about the African community in China, I think also it's a bit broader and a bit deeper. Sometimes it's just skin color. None of this is acceptable. And I think some very, very hard lessons are being learned over here, that we don't discriminate against a whole continent of 50-something countries. It's not just one region, but it's made up of diversity and vibrancy of individuals.
Absolutely.
But at its core, that we shouldn't look at people for their skin color, whether they're from that region or not.
I also have to say that there is always a certain sector of the society in China, and I'm probably right also for many parts of the world. There are people who are ill-informed, who are ignorant, who pass on very hateful speeches or even do stupid things. These should not be encouraged, and the policymakers should really have a guiding responsibility to make sure that the atmosphere, the attitude, the general attitude is not one that would encourage that kind of attitude. I do want to ask one more question, again with James. Looking around the world, vulnerable groups, not just African Americans in the United States, but really in everywhere. Do you think this pandemic is going to make a difference for policymakers around the world to really wake up and say, hey, maybe we should stop the trend of privatization a little bit and really think how we do better next time so that not just the people who have the power, who have the means, can get tested and treated, and it's not just another fact of life?
I think you're absolutely right. This, as I said, is a moment where we've all been humbled, where we've all been brought to our knees, where we've all been asked again to respond to a moment in society. And that moment is that we should have an equal society. We're seeing our own communities do this in marvelous ways because we can't call on our neighbors. For example, you can't knock on doors and physically meet people anymore. The telephone or using social media. And I think programs such as this and what you're saying all the time is extremely important and extremely impactful going forward.
Okay, thank you so much, James. Professor Lachmann, 10 seconds. Would you have something to add there?
Well, I think any major change is going to tend less on policymakers and more on mass pressure. Certainly in the United States, people who weren't aware of the consequences of lack of health insurance will be now.
All right, we have to leave it there. Many thanks to Professor Richard Lachmann and James Chau. And with that, we come to the end of this edition of The Point with me, Li Xin. As always, you can follow me on Facebook and Twitter using the handle The Point with LX. Thanks for watching. You've got The Point.